All right, let's talk about something almost all of us have gone through, getting a blood test. Specifically, we're going to dive into one of the most common ones out there, the complete blood count, or CBC. It's a super routine part of any checkup, but for most people, the results look like, well, a totally foreign language. So today, we're going to be your translators.
Come on, you know the feeling. You get that piece of paper back, and it's just this wall of letters and numbers. WBC, RBC, HGB, PLT. It can be seriously overwhelming. It feels like the secret code. But here's the thing. It's a code that's telling the story of your health.
And it all starts right here, with this simple little vial of blood, usually with a purple cap. But packed inside this tiny tube is a whole universe of information. Our goal today? To hand you the translation key so you can start to understand that story for yourself.
Okay, so let's try thinking about this CBC a little differently. Instead of some scary medical test, think of it as a language that your body is using to talk to us. We just need to learn a bit of the vocabulary and grammar. So, what is a CBC at its very core? Well, it's pretty much what it sounds like. It's a complete count of your blood cells. But it's also this incredibly powerful screening tool that takes a close look at the three major players that are constantly circulating through your veins.
So who are these major players? The CBC breaks them down into three main groups, which we can just call the big three.
First up, you've got your white cells, which are also called leukocytes. Then you have your platelets. And finally, your red cells. These are really the main characters in the story of your blood. And the CBC, well, it gives us a precise head count for each one. And they each have a distinct and absolutely vital job to do. Your white cells, they're the army for your immune system. Platelets are like the emergency repair crew. And your red cells, they're the oxygen delivery service. So the number of each tells doctors if these critical jobs are getting done the way they should be.
First up, the white blood cells. In a teeny tiny drop of blood, a normal count is somewhere between 4 and 10,000. Think of these as your soldiers. So if that count is high, it could mean your body's fighting off an infection. If it's low, it might mean your immune system is a little bit compromised.
Next, we have platelets, with a normal count somewhere between 150 and 450,000. See how the numbers are jumping up? These little guys are the first responders whenever you get an injury. You get a cut, they rush to the scene to plug it up and start the clotting process. This number gives doctors a really good idea of how effective that crucial response is.
And finally, the red blood cells. Just look at that number. We're not talking thousands anymore, we're talking millions in that same tiny drop of blood. Their entire job, their whole reason for being, is to carry oxygen from your lungs to every single part of your body. This massive fleet just goes to show you how vital that mission really is.
Okay, so counting the cells is the first big step. But when it comes to red cells, the CBC goes way, way deeper. It's not just about the quantity, it's also very much about the quality.
Two of the most important measurements for red cells are hemoglobin and hematocrit. Hemoglobin is the specific protein inside the red cells that actually grabs onto the oxygen. You can think of it as the cargo itself. Hematocrit, on the other hand, tells you what percentage of your total blood volume is actually made up of these red cells. It's a great big-picture look at your body's oxygen-carrying capacity.
Now let's peel back another layer and get even more specific. The CBC can actually look at the characteristics of the individual red blood cells. Are they big or are they small? Are they kind of pale or are they a nice deep red? This is where something called the red cell indices come into play.
And this is where it gets really cool. So we've counted the entire fleet of red cells, but are they all in good shape? Are they well built and are they carrying a full load of that oxygen cargo? The red cell indices give us those answers.
This is how we get that quality report card. First, there's the MCV, which tells us the average size of your red cells. Then you have MCH, which measures the average weight of the hemoglobin cargo inside each cell. And finally, MCHC tells us how concentrated that hemoglobin is, which is what actually gives the cell its rich red color. Put them all together, and you get a super detailed profile of your average red blood cell.
Now, here's the crucial part. These indices are diagnostic clues, like for a detective. If the MCV is low, doctors call it microcytic, which just means the cells are too small, and that's a classic sign of something like iron deficiency anemia. If the MCHC is low, the cells might be hypochromic or pale, which points to other issues. You see, each index is another piece of the puzzle.
But the investigation doesn't always stop there. Sometimes, the first round of numbers just raises more questions. And that's when a doctor might order a deeper dive to get an even clearer picture of what's going on.
You might see something called a CBC with diff. It's super common. That diff stands for differential. Remember how we said white blood cells are the body's army? Well, the differential breaks that army down into its specific units. You've got your neutrophils, your lymphocytes, your monocytes, and a few others. And this tells doctors if you're fighting off a bacterial infection versus a viral one, or maybe just dealing with an allergy.
Another related test you might hear about is the ESR. And honestly, it's a fascinatingly simple idea. You just put some blood in a very thin tube, and you wait. You literally just measure how far the red cells sink down in 1 hour. That's the whole test. And a faster than normal drop can be a big sign that there's inflammation happening somewhere in the body.
The key thing to remember here is that the ESR is an indirect clue. It doesn't point to one specific disease, but it's a really powerful signal that something inflammatory is going on. And that's why doctors often use it to monitor conditions like rheumatoid arthritis to see if treatments are working to bring that inflammation down.
So, let's bring this all back together. We've got the counts, the percentages, the indices, and these other add-on tests. What do we actually have when we put it all on the table?
What we get is a complete blood picture. Every single one of these values, from the white cell count all the way to the ESR, is a piece of a much larger puzzle. No single number can tell the whole story, but when you look at them together, they create this incredibly detailed snapshot of what's happening inside you at that very moment.
And that brings us right back to where we started. The CBC isn't just some scary list of numbers. It's a narrative. It's language. And once you understand the basics of the translation, you can start to actually read the story that your body's trying to tell you.
The CBC is an incredible tool right now, but it really makes you wonder, doesn't it? As our technology gets more and more advanced, what other secrets, what other amazing stories about our own health will we someday be able to unlock from just a single drop of blood?